Unresponsive patients often lose their protective gag reflex, which naturally clears foreign material, such as vomit, food, or blood, from the airway. Inspect a patient's mouth early and often. Solid objects that can be seen can be removed easily with a gloved finger. Take care not to push an object further down into the airway. If you hear gurgling or if the patient vomits, fluids are threatening the airway. Act fast. You'll need to quickly roll the patient onto her side to clear it. Grasp the arm on the opposite side of the patient near the elbow. Pull it in to brace the patient's side. Place your free hand underneath the head and neck. Roll the patient in one piece like a log, lifting the head to keep it in line with the rest of the body. Roll the patient far enough to allow fluids to flow out of her mouth. Remove any material still in the mouth with your gloved finger. Once clear, keep the patient on her side to help protect the airway, or return the patient to her back if you need to provide further assessment or care. Placing an unresponsive patient in the recovery position uses gravity to prevent the tongue from blocking the airway and allows fluids to drain passively from the mouth. To place a patient in the recovery position, slide the patient's arm nearest you straight out above his head. Bring the opposite leg upright so his foot is flat on the ground next to his knee. Take his far arm and bring it across his chest, placing his hand on the shoulder nearest you. Grasping the far hip and shoulder, roll the patient in one piece, keeping the head, shoulders, and torso from twisting. The patient's knee and elbow will make contact with the ground, stabilizing the body and allowing you to provide other care. Roll the patient forward enough to ensure an open airway. Make sure there is no pressure on his chest that might restrict breathing. If a mechanism of injury to the spine exists, do not move the patient into the recovery position unless you need to leave them to get additional help. As you learned earlier, oxygen is essential to sustain life. Breathing is the action of bringing oxygen into the lungs, where it can be transferred to the rest of the body. Suction created by expansion of the chest draws oxygenated air through the airway and into the lungs. The small air sacs in the lungs transfer the oxygen into the bloodstream for circulation throughout the body. Carbon dioxide, a waste product created by the body, is released in the exhaled air. Rescue ventilations are artificial breaths given to someone who is not breathing. Ventilations are performed by blowing air into a patient's mouth to inflate the lungs. The air you breathe contains about 21% oxygen. Your exhaled air contains up to 16 to 17% oxygen. This exhaled oxygen is enough to support someone's life. As a first aid provider, you should use a protective barrier, such as a ventilation shield or mask, when giving ventilations to minimize your exposure to infectious disease. To give a rescue ventilation using a ventilation mask, inspect the mask to make sure the one-way valve is in place. Place the mask flat on the patient's face, laying the top of the mask over the bridge of the patient's nose. Place the palm of your hand on the patient's forehead and use your thumb and forefinger to control the top of the mask. Use the thumb of the hand lifting the patient's chin to control the bottom of the mask. Use head tilt chin lift and bring the patient's face up into the mask to create an airtight seal and establish an airway. Take a normal breath and blow through the valve opening to deliver the ventilation. Each breath should be 1 second in length and have sufficient volume to create a visible rise of the patient's chest. Let the patient completely exhale after each breath. Take a fresh breath for the next ventilation. When giving ventilations, avoid blowing too hard or too long because air can be pushed into the stomach, making additional ventilations more difficult and increasing the chance of vomiting. To determine if your ventilations are effective, watch the patient's chest when you blow. Create a smooth, visible rise of the chest over 1 second. If your ventilation does not result in a visible rise of the chest, use the head tilt chin lift technique again and attempt another ventilation. Do not delay further care if the chest still does not rise. To give a rescue ventilation using an overlay shield, place the ventilation port of the shield in the patient's mouth. Seal the patient's nose by pinching the nostrils closed. Use head tilt chin lift to establish an open airway. Take a normal breath. Press your mouth on the shield over the patient's mouth to create an airtight seal. Blow through the port to deliver the ventilation. Each breath should be 1 second in length and have sufficient volume to create a visible rise of the patient's chest. Remove your mouth and let the patient completely exhale. Take a fresh breath for the next ventilation. The same technique can be used to provide mouth-to-mouth ventilation if you elect to not use a barrier to ventilate. The circulatory system includes the heart and a complex network of blood vessels located throughout the body. The heart mechanically contracts, creating enough pressure to push blood through the blood vessels. When you breathe, small blood vessels in the lungs absorb oxygen from inhaled air. Oxygenated blood then goes to your heart, where it is sent out to the rest of your body. In your heart, impulses running along an electrical pathway trigger the rhythmic mechanical contractions that move blood forward. Conditions can develop to disrupt this electrical process. When this happens, contractions become ineffective, and the forward flow of oxygenated blood stops. This is known as cardiac arrest. The brain is particularly sensitive to the lack of oxygen. Brain tissue begins dying just 4 minutes after circulation stops. After 10 minutes, the chance of survival is unlikely. Cardiac arrest usually occurs as a complication of cardiovascular disease. Other causes include electrical shock, severe blood loss, drug overdose, severe allergic reaction, and drowning. The treatment for cardiac arrest is cardiopulmonary resuscitation, or CPR. CPR artificially circulates oxygen-rich blood using a combination of chest compressions and ventilations. The structure of the chest allows you to compress the breastbone downward. This squeezes the heart and raises pressure in the chest. Both of these mechanisms force blood out to the rest of the body, including the brain. The amount of blood flow created by chest compressions depends greatly on the technique of the provider. To perform compressions, begin by positioning the patient on his back on a flat, firm surface. Kneel next to the patient's chest. Place the heel of your hand on the center of his breastbone between the nipples. Place your other hand on the top of the first. You can interlace your fingers to help maintain position. With your knees comfortably apart, get as close to the patient as possible. Bring your body up and over the patient so your shoulders are directly above your hands. Using upper body weight, push straight down to a depth of 1 1/2 to 2 inches, or about 4 to 5 centimeters. Relax and allow the chest to fully expand to its normal position without losing hand contact. Move immediately into the downstroke of the next compression. Continue compressions at a rate of about 100 times per minute. Always compress fast and deep when performing compressions. Maintain compression speed to create smoother, deeper compressions. Count compressions out loud to help maintain a consistent rate.
15, 16, 17,
It is also important to allow the chest to fully expand at the top of each compression. Keeping your elbows and shoulders locked, allows you to use upper body weight to conserve energy.
Now that you've learned the basic life-supporting skills involved in performing emergency care, let's learn how to apply those skills in an emergency. The initial assessment is the first brief evaluation of a patient's airway, breathing, and circulation. As you recall, it is essential to make sure an emergency scene is safe before you enter. Use setup to evaluate the scene. Look for any mechanisms that could have caused spinal injury. If it is safe, introduce yourself and your level of training.
Hi, my name is Wendy. I'm trained in first aid.
If the patient does not respond to your voice, tap his shoulder and shout loudly,
Are you okay? Are you okay?
If the patient still does not respond, assume a life-threatening emergency exists. Ask other bystanders to activate EMS immediately. If you are alone, you'll need to activate EMS yourself before continuing your assessment. Next, open the airway. Use the head tilt chin lift maneuver to make sure the tongue is not blocking the patient's airway. Quickly inspect the mouth for foreign material. Next, assess the patient for normal breathing. Look, listen, and feel for breathing. Look for visible rise and fall of the patient's chest. Place your ear close to the patient's nose and mouth and listen for exhaled air. Feel for breath on your cheek. Take at least 5 seconds and no longer than 10 seconds to check. If you are not sure whether breathing is present, assume it is absent. Normal breathing results in regular movement of the chest and the flow of exhaled air is clearly evident. Weak, irregular gasps sometimes occur due to cardiac arrest. These reflex actions result in minimal movement of the chest and provide no usable oxygen for the patient. Consider breathing to be absent if this occurs. If the patient is breathing, it is safe to assume that his heart is beating. In this case, the biggest concern is obstruction of the airway caused by the tongue. Placing the patient in the recovery position is the best way to maintain and protect the airway. When breathing is absent, CPR must be performed. Cardiac arrest has occurred. Continue the initial assessment only if problems with the airway and breathing are being fully managed. Quickly scan the patient for signs of severe bleeding. Look for any large blood stains on the patient's clothing or pooled blood on the ground. Feel under the patient with gloved hands to reveal hidden wounds. To finish the initial assessment, determine a patient's tissue color and skin temperature. Tissue color depends on the amount of blood circulating below the skin. Normal tissue color is light pink. Poor tissue color can be pale or blue, indicating a lack of oxygen in the blood and the possibility of shock. Assess tissue color in patients with darker skin by looking at their lips or fingernail beds. Skin temperature can be assessed by touching the patient's forehead with the skin of your wrist. Take care not to touch any potentially infectious body fluids. Normal skin temperature is warm and dry. Cool, moist skin may indicate the presence of shock. Whenever you suspect a medical emergency has occurred, begin by performing an initial assessment. It is a simple and reliable method to quickly identify life-threatening conditions that require your immediate care.